Welcome back to the Metro on WDET. I'm Robin Vincent. Last week, Detroit got some bad news. Its air quality is lousy, really lousy. In fact, Detroit ranks 6th in the nation for smog and soot exposure. To many, this news is not entirely surprising. 2 summers prior, wildfire smoke from Canada caused people to stay indoors or wear a mask outside. And to people who live near Detroit's heavily industrialized areas, the air quality is a constant issue. Those things caused Detroit to rank 3rd for asthma last year. Here's State Representative and congressional candidate Donovan McKinney speaking to that issue yesterday on our program.
No wonder why we have some of the largest per capita rates in terms of asthma. There's areas in my district, by the time your child hit the age of 5, they have an 85% chance of developing asthma. I know I developed it at 7. My 3-year-old baby boy has been diagnosed with pre-asthma.
Now, McKinney lives on Detroit's east side. Today, we want to talk with someone who lives on the west side of the metro region in Dearborn's South End neighborhood. That community is surrounded by industrial plants like Ford's River Rouge complex and Cleveland Cliffs steel mill. So what is it like to live near industry in an already polluted region? And what are community residents doing to create a cleaner environment? To discuss that now, we have Sam Lukman on the line. She's a resident of Dearborn's South End neighborhood and a community activist. Sam, welcome to the Metro.
Thank you for having me.
And we also want to hear from you, our listeners. Do you live in a neighborhood with a lot of air pollution? What is that experience like for you? The number is 313-577-1019. Sam, we just got this report from the American Lung Association noting that Detroit is 6th in the nation for air pollution. Does this surprise you at all?
No, absolutely not. We've seen reports similar that rank Detroit in the top 20, in the top 10 year after year. So this is not surprising at all.
Sam, I wonder if you could give us a window into your life. What is air quality like, let's say, on a random Tuesday or Wednesday in Dearborn's South End?
Well, I mean, air quality impacts your way of life from your ability to do certain activities outside to, your health in the long run. And so if you were to look at any random day, especially in the warmer weather where the air kind of gets trapped, the pollution gets trapped in a certain area, we could have a bad air quality day where, you're limited from barbecuing, filling gas. If you have asthma or you're at risk, like you're an old elderly person, you shouldn't be outside. Those things happen very, very frequently in our area, and people just don't know about it. There hasn't been much awareness about the issue.
And so that means you're not necessarily rejoicing when the weather starts to turn and it gets warmer. I'm guessing that for you, you're starting to become more vigilant and think about the ways that's going to affect your health.
Absolutely. And I have to think about my children. As the rep indicated, we have extremely high rates of asthma, 3 to 4 times the state average, including for my son. And then you think about other things, not just asthma. My son has high blood lead levels, and it's not because of drinking water, because we've drank purified water since his birth. And it's from the air he breathes, literally. Lead and manganese are pumped into the air. And so I have to think about, if I send my kid outside, what other things am I going to be giving him? Is he going to have higher lead levels? Is he going to have an asthma attack? Is he going to have cancer? All of those things play in your mind. And so we're really stuck between a rock and a hard place. What do you do when the weather gets better? How can you enjoy your life if when you go outside, you're literally being poisoned to death?
Talk about that as a constant weight on your shoulders, because that really it takes up, I mean, forgive the pun here, but it takes up a lot of the oxygen when you're constantly having to think about how interacting with your environment is going to impact your health and the health of your family.
It's not just thinking about it preemptively. It is literally a day-by-day struggle for many, or most, if not all of our families here in the South End. My mother, for example, she's a cancer survivor. She's had almost half of her lung taken out. My mother has never smoked a day in her life. And yet here we are, she's in remission, and I have to deal with living with her and taking care of her. My son has had a tumor removed. My neighbor has no breast. And that's because she's had a double mastectomy. Kitty corner to us, my other neighbor died of breast cancer. Right next door, my friend's father died of COPD complications when COVID hit. So we have almost every single house on our block is impacted either by asthma or cancer or some cardiopulmonary diseases. It's not just that we can't go outside or do things. It's that we have to struggle with this every single day with an impacted family member. It's not easy living here. It's not easy. And you think about, being able to just go outside and go to the park or walk around the block. Those are things that literally are going to be killing you or contributing to the detriment of your health.
That's something for us to sit with for a moment. Just going outside, walking down the block, walking to the park can potentially be a very detrimental thing to your health. Sam, recently WDET's Brianna Tinsley spoke with the director of advocacy for the American Lung Association about Detroit's poor air quality. Here's what the advocate had to say.
One of the reasons why Detroit air quality for ozone air quality has gone bad is because of the 2023 wildfires. And 2023 wildfires is part of the disasters that have occurred because of extreme temperature changes in our atmospheres.
So essentially, she's saying that the air quality got a lot worse in Detroit because of the Canadian wildfires and the subsequent smoke from them that drifted our way. What was the summer of 2023 like for you in the South End community?
So first, just to respond to that, Detroit and our area has been in non-attainment for ozone particulate matter and even sulfur dioxide for a decade prior to that wildfire. So to say that it's, because of the wildfires that we have bad air quality is really being disingenuous to the actual struggle. We've had to sue the... Yes.
If I may jump in for a moment, you said non-attainment. What does that mean?
Non-attainment is basically a term that is used to say that because this chemical is so high in the air, it is basically hazardous to human health for you to breathe that air. And so because we've had ozone particulate matter, which is basically a type of dust or chemical in the air, we've had so much of it in the air that the EPA and EGLE say, you know what, this air in this community is bad for your health because of this chemical. And we've also had the same non-attainment standard used for sulfur dioxide, which means that the air in this area is bad with two different chemicals. When you combine the 13 different carcinogens that are being pumped out by the local industries here with the fact that this area has been in non-attainment, you're really, really putting a recipe for disastrous human health impacts into this community.
Mm. This is the Metro on WDET. I'm Robin Vincent. We're discussing a new report that ranks Michigan 6th in the nation for particle air pollution. Our guest is Sam Lukman. She's a resident of Dearborn's South End, which is highly polluted. She's also an environmental activist. We're talking with her about her experience living in the South End neighborhood in Dearborn and what she's trying to do to create a cleaner environment. So, Sam, back to the summer of 2023 and what that was like for you during those very poor air quality days via the Canadian wildfires.
Mm-hmm. Yeah, so during those days, I mean, I knew better than to send my kids outside, even though, everybody wanted to be outdoors. I mean, we only have a few really good months of weather in Michigan. And so it was really a struggle. And it really, for me, it pointed to a need for indoor clean air recreational facilities that are really necessary in communities like ours. But I also watched my neighbors sending their kids outside and walking around in literally a haze. It was really, really foggy because of the smoke in our community. And so I see these kids and these people outside playing, and I'm like, they're so oblivious. They don't know that being out there, playing out there, is actually very, very dangerous for them, and it will contribute to them having an asthma attack or developing asthma. And so it further pointed to the need to raise the level of awareness among communities like myself, like my own, that are, really, really ignorant of the hazards of poor air quality that they live in.
Let's talk about that, some of your activism. So you work with a lot of groups, including the Friends of the Rouge, the Clean Air Coalition, your neighborhood association, an interfaith group, and Dearborn Public Schools. Can you talk specifically about some of the things that you've done to raise awareness and to try and create a cleaner environment in Dearborn's South End?
Yeah, so our community, because of urban renewal policies that were put into place starting with Hubbard and continued on until the recent decades even, we were faced with a lot of industrial proliferation, and as a result, we had very, very limited tree cover. Within 5 years ago, we only had about 3% tree coverage in the South End. And so one of the things that we started to do is we started to plant trees. Now, trees are not just good for, urban heat pockets or recreation or beauty or whatever. It's also great for absorbing particulate matter and different types of pollution. So we've had almost 1,000 trees, hundreds of trees planted in this area that are still growing to this day. That's one of the things. But we've looked at other things of how we can mitigate the issues here. One of the ways we found is that maybe if we could get air purifiers to every single home, that would at least give residents a relief within their house to have clean air. And so as a part of the consent decree that was launched against the local steel mill, the Concerned Residents for South Dearborn, which is the neighborhood association, came up with a project to use some of the penalties from that lawsuit to purchase purifiers for every single home. There are a lot of different things that you can do and that we should do to kind of help mitigate the impact. But ultimately, the main thing that we need is accountability of these corporate polluters. And so the biggest thing that I would like to see that I'm working with some of these groups on is trying to push for legislation, trying to push for accountability of these corporate polluters.
What does that look like, pushing for that accountability? I mean, you're saying that lobbying lawmakers is where you need to start with that. Have you begun that process, and have you found that any lawmakers are amenable to your concerns?
Yeah, absolutely. For years, we've been having this process in place, and one of the pieces of legislation that we wanted was a cumulative health impact legislation, as well as another one that says that all fines and penalties from environmental, transgressions go back to the impacted community. Right now, any fines that are levied against the corporate polluter go back to the state general fund, and they can be used anywhere across the state. We believe that it should be used in the impacted community. For example, buying purifiers or fixing HVAC systems or providing some relief to the residents of the impacted community. Those are just a couple of the pieces of legislation that we've been pushing for. And yes, there have been. Abdullah Hammoud, before he was our mayor of Dearborn, was our state rep, and he had introduced a cumulative impact legislation. And it's still, something that we're pushing for to get reintroduced on the floor and get voted on. So yes, there have been people that, or legislators that have been receptive to these things. One of the other ways we push for is federally. Representative Rizalva from Arizona, God rest his soul, had introduced an environmental justice piece of legislation on a federal level, and he actually came and visited the South End. And so we are seeing some movement on that front. My biggest concern is trying to get more awareness raised, not just on the outside, but on the inside, for residents themselves to be able to defend and protect themselves and their children from this exposure.
Sam, I think some people listening to this conversation would wonder why people move to the South End at all, since, to your point, there's so much heavy industry there. What would you say to them?
Well, the first thing is that, that question is a question of privilege. You're assuming that these people have the means to live elsewhere. The South End really is a low-income community. Historically, we've also been a welcome landing mat for immigrants. So you find that this area is really about 50% still first-generation immigrants. And it continues to be kind of a stepping stone. People come here not knowing that there is this pollution, this hazard to their health, and then they end up moving up when they have the means and moving out of here. But to essentially say that, people should not have come here, people should move out of here, means that you're really not taking into account the community that is here, the history that is here. People were here before all the industry was here. And we have to understand that the industry was placed here intentionally around a community of color and continues to be done that way, expanded that way, because we are a community of color, a community that does not know the different environmental issues and hazards that we are being exposed to.
So it's a question of environmental justice. Sam, you have an idea of capping pollution by particulates per neighborhood. If we capped pollution in all areas equally, then presumably industry would have to move elsewhere to places that are, say, cleaner and make them more dirty. I don't think that you want that to happen. So do you think it's a better idea for industry to continue in the area and for the government to pay people to leave?
Well, no, it's not. It's not so mutually exclusive. The way I use an analogy, and I say every community has a trash bin, and the state basically says to companies, you can throw one piece of garbage into a trash bin in the state. Well, if every company comes to my community and throws their wrapper into my trash bin is overflowing and other communities have empty ones. What the concept of cumulative health impact says is that if a community's trash bin is already overflowing, you should not be adding more trash to it. So it's kind of like preemptive or future looking, proactive looking, where you're not supposed to be adding more to it. The other thing you mentioned about is how do we live next to industry? Really, when we look at for example, Cleveland Cliffs, the local steel mill that I live by, they have thousands of air quality violations, meaning that there is already a standard in place and they're supposed to be adhering to those standards, and they continue to emit and violate those standards. Similarly, DTE and the Dearborn Industrial Generator Plant. And when you put all of these combined polluters in an area, in one specific area, not only polluting what the state tells them, that one wrapper, but throwing 5 wrappers in at a time, then you have an area that is oversaturated with pollution and limited accountability is had here. So there really needs to be a way for the state to come in and say, you know what, you've been polluting excessively, too much, and you need to either adhere or stop your operations. You can't continue to just flout the law. And so it's not such a clear cut and dry where you're saying, well, you have to be placed somewhere else or we have to move. There are ways that these companies can live next to residents in a manner that is not going to be killing them. And they just need to adhere to the law in order for that to take place.
Sam, before we let you go, part of the blame here could be put on the federal government. Former President Joe Biden signed a lot of legislation to transition the economy to rely on greener, cleaner energy. But a lot of money with the Inflation Reduction Act hasn't been spent yet. And we've really only gotten started on transitioning to cleaner energy. And there are a lot of uncertainties about that now under President Trump. How much do you think federal officials should be doing to transition our economy to rely on wind, solar, an industry that doesn't emit a lot of pollution in the last 30 seconds that we have here?
Federal government has a big role to play, but ultimately the issues that we face on the ground are literally local issues that start with the city. If you look at Marathon would not have been able to expand if Detroit hadn't allowed them to buy out the properties and then converted or rezoned them into industrial properties. The state should have stepped in and said, we will not issue another permit allowing Dearborn Industrial Generator to exceed or increase their formaldehyde emissions, considering that they've already been violating in the past. These issues that we're facing really start at the municipality and then at the state, and the federal government is just at the top level. It really is all politics, all accountability starts at the local level, and that's where the focus needs to be. It's not so much the federal level that can make these changes, in so much as the municipalities start representing the people that they are supposed to represent, they purport to represent.
Sam Lukeman. She's a resident of Dearborn's South End neighborhood and a community activist working to transform her neighborhood to one that has cleaner air. Sam, thank you so much for joining us on the Metro.
Thank you for having me.
Coming up, we'll continue talking about our air quality and explore the connection between that and asthma rates and the intensity of many allergies that we face. We also want to hear from you. Do you have asthma or allergies? What's your condition like right now? The number is 313-577-1019. This is the Metro on WDET. Stay with us. Welcome back to the Metro on WDET. I'm Robin Vincent. We've been talking about how Detroit ranks 6th for air pollution in the nation. That's according to a new report. And we just spoke to someone who's directly impacted by that because she lives in the heavily polluted neighborhood that is Dearborn's South End. But it's not just people like Sam Lukeman. People across the Detroit region are impacted by poor air. That in part helps explain why rates of asthma are high here and why allergy cases can be so severe. To discuss these things now, we're joined by Dr. Garen Wolf. She's an allergy and immunology physician who works in Detroit. Dr. Wolf, welcome back to the Metro.
Thank you for having me.
So a lot of people have allergies, but they may not know why. So I want to ask Dr. Wolf, why do people have allergies? How much of that is genetic? And how much of our environment contributes to allergies?
So allergies for a lot of people are genetic. We can unfortunately blame mom and dad. So if you have a mom or dad that has allergies, meaning seasonal allergies referred to as hay fever, asthma, eczema, and food allergies, the likelihood of you having one of those conditions is very high. So I have patients whose dad has asthma, mom has eczema, and they have seasonal allergies. There's actually a phenomenon in the allergy immunology field called atopic march. Atopic is our technical word for allergic march, which means as you progress through your life, you can get an allergic disease. Usually as a baby, it's eczema. Then after eczema, it's food allergies. After food allergies, it's seasonal allergies. And then after that is asthma. And that can progress as you get older.
Okay, so the genes, an epidemiologist that I knew, she used to say that your genes give you the gun and your environment pulls the trigger.
Yes. So, and then you have people who do not have a family history of allergies. And then you have to ask yourself, well, where did their allergies come from? They're kind of the patient zero. And so some people, they produce more histamine, which is a molecule your body releases when you have a reaction. It's what causes you to sneeze and cough. Some people just produce more. And so when you have more pollen in the air, which we do now, they just become hyperreactive to it and they start having allergies. And they become the person their children can blame when their children start having allergies, unfortunately.
Could you draw out the connection a little more for us between allergies and asthma?
Yes. So the allergic diseases are allergies, meaning seasonal allergies, hay fever, runny nose, stuffy nose with change of the seasons. The second allergic disease is eczema. The other word for that is atopic derm, which is a skin condition where your skin gets very dry and scaly. The third allergic disease is food allergies, so peanut allergy, shellfish allergy, tree nut. And then the fourth one is asthma. And there are so many different types of asthma. Some people have allergic asthma, meaning their shortness of breath and their wheezing and their chest tightness is only influenced by pollen. There's some people who have asthma and they're only influenced by smoke. So there's so many different types of asthma, but one of the most common is the allergic asthma. And these are people who are unfortunately in the spring, they end up in the ER because the pollen just inflames their lungs.
How serious are allergies? I mean, many people have them and they're oftentimes just annoying and disruptive. Before you got on the mic, you said it's about to get much worse. Talk about how allergies hurt someone's health.
So first, quality of life. I mean, I have people who come to me who have allergic rhinitis, which is allergy of the nose, hay fever, and they just can't breathe out of their nose. They can't sleep. So now you have people who are unable to sleep. They have brain fog throughout the day. Kids have to leave school early or they don't go to school because they have a stuffy nose, runny nose. Just the quality of life is diminished. And quality of life is huge for people. I mean, I've had people after I treat them and there's like, I feel like a brand new person because I just could not breathe at night or through their nose or even, through their lungs. So first, quality of life, number one. Number two, for people who have allergic asthma, if their lungs keep getting triggered, your lungs can become stiff and your lungs won't be able to move. And the beauty of asthma, if you're going to look in the beauty of asthma, is that it's reversible. That's why I use an inhaler. You can open the lungs back up. But if you are constantly being berated with smoke, constantly being berated by pollen, your lungs can get very stiff. And then an albuterol inhaler does not work. And you get more of the COPD picture, which is a more severe lung disease. That's why I always want to treat when people come to me for asthma.
So when you talk about someone's lungs getting triggered, that has me thinking then that the more air pollution and dirty air particulates that there are, the worse someone's allergies could be.
Definitely. And in Detroit, we have so many factors. And I was listening to the last guest. Of course, we have the wildfires, which were horrible in 2023. 2024 was quite bad, too. 2025 is supposed to be normal fire activity, which is an interesting way to put it. But those fires bring over pollen and mold. So you have that. Of course, you have the refineries in Southwest Detroit. I mean, you have all of the refineries. We are the Motor City, so you have the car pollution. And then you add the pollen, you just have a perfect storm of air particulate matter that inflames people's lungs.
Dr. Wolf, when you talk about all of these different environmental toxins that are getting into our lungs, it has me wondering how you protect yourself and how you protect your family, let's say during the smoke from wildfires, which, I lived in wildfire country out west in Wyoming and Colorado. And what I learned there was that it was actually more dangerous, the particulates that could travel farther. And so those of us living in Detroit then who are breathing in that air that's traveling really far from Canada, that it's actually more damaging than being close to that wildfire. So what are you doing to protect yourself and your family?
So I don't have anyone in my family who has asthma. For people who have asthma in particular, I tell them make sure you have your inhaler. Always have your inhaler so you won't have an asthma attack. For my family in particular, air purifiers. So I'm a big fan of a HEPA filter. HEPA filter is a high efficiency particulate filter. That's the best one you can get to filter your air. So that's number one. Number two, making sure that your windows, at night are closed because sometimes the air, especially high pollen air, can come in at night. You've got a higher percentage of that. And that's pretty much it for my family. We try to mitigate, but, you do what you can.
This is the Metro on WDET. I'm Robin Vincent. We're talking about how poor air quality in Detroit impacts rates of asthma and the severity of allergies. Our guest is Dr. Garen Wolf. She's an allergy and immunology physician who works in Detroit. Dr. Wolf, you've said September is the worst time for asthma. There's a lot of ragweed in the air during the third week of that month. What's the connection between ragweed and asthma?
So the third week of September is called Asthma Peak Week. So in the United States, that is the week where adults and children are hospitalized. They go to the ER or they're hospitalized for asthma attacks. And what ragweed does is that it triggers your lungs to become inflamed. But also in the fall, you have people returning to work, people going to the offices. You have other people who, because it's cold, you have the viruses that are coming around. School buses emit fumes, when kids go to school. So September is not only bad for ragweed, but you have the other factors that contribute, and that's how you end up with adults and kids in the hospital.
Mm-hmm. I've read that certain allergies make you more susceptible to others, or at least your body's response to certain things. For example, if you're allergic to ragweed, you could be allergic to so-called ragweed relatives like melon, zucchini, cucumber, and sunflower seeds.
Right.
Could you talk about why this happens?
Yes, that's actually so interesting. It's called food pollen syndrome. So I have patients who come to me and I ask them, are you allergic to any foods? And they'll say, well, Dr. Wolf, when I have a kiwi or a tomato, my lips get a little funny, they tingle, my throat itches, I feel like it's going to swell, but nothing happens to me. I don't go to the ER. And when I skin test them, they're positive for a tree or a grass or a weed. So what happens is that the same proteins that are on grasses, trees, and weeds are actually on fresh fruits and vegetables. And your body has no idea what's going on. So when you eat a fruit or you eat a vegetable, your body gets confused and you start having allergy symptoms. And so I actually provide a chart in my office for people who do have those symptoms because garlic is associated with some types of ragweed. Again, tomatoes, strawberries, kiwi. So there are a couple ways you can combat that. Number one, you can heat the food, cook the food. So usually if you have a dried kiwi, you're fine. Or if you have a kiwi that was baked in a pie, you're fine. So you cook the food, meaning you break down that protein that's on the outside. Number two, you can take a Zyrtec before. I have a lady that has really bad pollen food syndrome. She was in Jamaica. She could not help but eat all the fresh fruit. So she pre-treated herself. She was like, I'm not going to not eat this. So she took a Zyrtec before she ate the fruit and she was perfectly fine. And the last way you can treat this is just avoid it. Nobody likes to avoid fruit.
No.
Nobody wants to do that.
Dr. Wolf, we've discussed what people can do to protect their lung health and deal with allergies. In the last 30 seconds we have here, what should the state and county be doing to make life easier for people with asthma or allergies?
Well, I think, like the last guest mentioned was regulations on these refineries that are really providing such significant pollution to the air, which results in, inflammation of the lungs. I also think we need to do a better job of making people aware of the pollen index, because there are websites you can go to in which you can know when the high pollen times are, how you can kind of address those. And I really think there should be more education about allergies. A lot of people come to me and they never know they can be treated for allergies. So.
Dr. Garen Wolf, an allergy and immunology physician who works in Detroit. Dr. Wolf, thank you so much for joining us on the Metro.
Thank you.
Coming up, a lot of folks are locked up for marijuana charges despite the drug now being legalized in Michigan. We'll hear more about that in 7 minutes. This is WDET-FM, Detroit Public Radio, your connection to news, music, and conversation. And this is the Metro. Stay with us.